It looks like most people have entered from the waiting room, so we'll get started. I'm just here to introduce Dr. Houpt. My colleagues, Dr. Donnelly and Vanessa Maley, are here as well, and we're all going to kind of help moderate and answer any questions you guys have. So we encourage you to enter any questions you have in the chat, the Q&A, and we can answer those throughout, but for the most part, we'll kind of save them up and then ask Dr. Houpt at the end. A lot of people registered for this tonight. It sounds like some people are having trouble hearing me. Is this any better?
Yes.
Okay. Thanks for letting me know. So Dr. Houpt we're seeing an Excel sheet there.
Sorry.
Is no problem at all. We've been dealing with a couple technical difficulties, but I think we're all set. So Dr. Houpt is an emeritus professor here at Cornell. She's so she has a veterinary degree. She also has a PhD. So she conducted behavioral research, and then she also was a founding member of the veterinary behavior specialty. And so she is a diplomat of the American College of Veterinary Behaviorists, but also helped form that group of specialists. So she's published in, I can't probably list all the species, more than I can remember right now, but she's a not so secret horse person. And so I think that she wouldn't argue with me saying that might be her favorite breed. She has a couple in her backyard. We might see them out the window there. And then my favorite fact about her is that she's ridden a horse on every continent except Antarctica. So today she's going to be talking to us about stable vices, which she's always quick to point out. She's referring, in fact, to our vices and not to the horses, and she'll explain that shortly. Thank you very much, Dr. Houpt, for joining us.
Thank you, Dr. Goodall. I'm happy to have this opportunity. So I'm going to be talking about what are called stable vices, but I feel that, in fact, the vice is ours for what we do to the horses. And let me see if I can get it to advance. Okay. I cannot. Okay, that started. Good. So the question is, should I punish that horse because she is not wanting me to handle that hind hoof? And I want you to take home the message that always try to find out why the horse is doing something. It's probably not because she's an evil animal. And in fact, this indicates to me that something is hurting her. In fact, her right leg is painful. So when I pick up her left leg, then she has to put weight on the one that's sore. And so she tries to evade that. And so the solution is not to hit the horse, but to give her a painkiller so that she doesn't mind having her foot picked up. In addition, we had a hard time making this video because whenever I have to pick up that hoof and clean it, I always give her a lump of sugar. So she doesn't mind as much as she used to. And now we'll see. Okay. So in order to understand why horses have these problems, we should look at the activity patterns of horses. So in the natural state, horses spend 60% of their time eating, 25% standing and resting, 9% walking, 7% lying. Notice there's no galloping or even trotting. Horses in a natural situation only do those things if something is chasing them. This is a graph of some Canadian horses up in Alberta, and the white on the graph is foraging or grazing. And notice that most of the graph is white. They get up in the morning and they start eating at 5, and they take a little coffee break at 9 to rest. This means stand resting. This polka dot is lying down. And then there are all the other behaviors. They quit at 11. They have a lunch at 11, and then they take another little rest here where they're resting or lying down, and then they have another big grazing session between 5 and 7 at night. And that indicates how much a horse will spend grazing if he is allowed to do so. So this is a typical horse band. There's a stallion, the gray horse, and he is not with the other horses. Usually the stallion is peripheral, looking out mostly not for wolves or things, but for other stallions that he wants to drive away. And then here's his band of these mares. Notice that most of them are eating, and there's some foals here too. So there's going to be a quiz at the end. What percentage of time do horses spend grazing? 60. But this is the way horses are kept by us. This is a typical British box stall. The only opening to the outside is this Dutch door. So if you close the Dutch door, the horse is in the dark. If the door is open, he can look out at least in one direction. So these misbehaviors I'm going to be talking about are called vices, but a better, more scientific title is stereotypic behavior, because it means a repetitive, functionless behavior. So what makes horses do this? Well, lack of contact with other horses, visual contact, but also tactile. If you can see other horses, that's good, but it's even better if they can touch other horses. Non-straw bedding seems to be another factor. So if you're using shavings, you might think about using straw. To cure any horse behavior problem, give them less concentrates and more roughage, because we know that the more concentrates they get and the less roughage, the more likely they are to show these behaviors. When people first started studying these, they said, well, obviously horses want to eat for a long period of time. So instead of feeding them twice a day, we'll feed them 3 times a day. And that made them worse. And I think it's what I call the airplane phenomena. You know, if I'm thirsty, I go to the refrigerator and I get a Coke. If I'm on a plane, I'm thirsty, and that cart is 4 rows away from me. And so it seems forever before they get there. And if I could stall walk, I would, waiting for them to come. So if the horse sees the grain cart 3 times a day instead of twice a day, he's actually probably going to spend more time doing these anticipatory stereotypic behaviors. So the 2 kinds of stereotypies, oral and locomotor, and I'm going to talk about the locomotor ones first. They can be divided into stall walking, or weaving, or pawing, or kicking. So the 2 kinds of stall walking. There's a fast kind, which is usually accompanied by the horse neighing and defecating. And that is probably escape behavior. She wants to get out of that enclosure. Or it could be separation anxiety. The other kind is slow and stereotypic, which seems to be more compulsive behavior. But this is an Arabian mare who lived in California, never had to be stalled until she moved to Chicago. And her new owner discovered that this is what she does in the stall. And that is probably a claustrophobic-like response. She was used to being with other horses and being free. When she was outdoors, even in Chicago, she wouldn't show that pacing behavior. It was only in the stall. So that was a drastic change of environment and a lot of confinement for that horse. Here is a miniature stallion, and he stall walks, but he is not defecating and neighing. He's just walking around. And that is the slow stereotypic kind. And you can see the path that he makes in the stall in the lower photograph. Let's see, so this is a fairly recent case.
You can see that the stall door is actually open. She put herself in that stall, I think with the intent of stall walking. But now that I've started paying attention to her, she's stopping.
So this is a horse
And
that is
as you
stall
can
walking.
see, she can leave that stall at any point in time and stop stall walking.
This horse was quote, cured using
That is good.
medication, but only for
Mom,
a short period of time.
come here now.
So who stall walks? Arabians and endurance horses, which are mostly Arabians. So how do you treat it, which is probably why you're all here? Well, the best thing is to remove the horse from the stall. Strangely enough, if you put them in a straight stall, they're often better. Some start to weave, and we'll get to weaving, but others are comforted by having a horse on either side of them. A stall companion, and I'll talk more about that. Anti-anxiety medication, which we have been moderately successful with using in horses with those problems, but that would require a veterinarian to prescribe the drugs. You can also, and this is Dr. Sue McDonald, University of Pennsylvania, cured a horse by putting hay in the circle that the horse was making in the stall, because she noticed that the horse would stop and eat hay when he got to the pile of hay. So she just spread out those piles, and the horse would take a few steps, eat some hay, take a few steps and eat some hay, which essentially is grazing. So it stopped the stereotypic type of behavior. So it's always worth trying. What about stall companions? Well, this is the Godolphin Arabian and Grimalkin, his cat, who was a companion to him. So this is a contemporaneous picture, sometime in the 18th century. But I think most of us are familiar with this horse and cat from King of the Wind, one of my favorite childhood books, and probably the reason why I have an Arabian. Other things you can do is give the horse more windows. You can try a mirror. Now you have to be careful. Horses will attack the mirror. So if it's glass, you have a problem. So a plastic mirror or a metal mirror can be used. Of course, putting the horse on pasture will almost always cure the problem, especially if they have other horses on pasture. What about weaving? Weaving is actually, in most horses, if you look carefully, he's not just rocking back and forth, he's actually walking. All 4 feet move. And this usually takes place at the stall door. Hardly ever had a horse that faced away from the door or to a blank wall. So I think it's escape behavior. And we use the same things for treating them. That is stall companions, getting them out of the stall, and if necessary, medication. And one of you wrote in and said you had a horse that weaved and what to do, and had tried most of the things that I suggested, except a stall companion and medication. So we can certainly try that. Why is this not moving forward? Then, of course, weaving in front of the window. Of course, weaving over the stall door. So as you can see, lots of different horses do it, but it's almost always this type of behavior. Let's see if I can get back one. Okay, this young horse, as you can see, weaves very quickly. And I had to tell the owner that it was not a very good barn, even though it's brand new, because the only window is up quite high. And although there's a horse on the other side of the wall, he can't see that horse. So giving the horse windows might solve that particular problem. Here is a pony that began weaving when he was tied. Now this is a teaser pony, and so it's a stallion, and behind him are all of those mares. So it's probably a pretty frustrating situation for him. And this is a traditional way to deal with it, is to prevent the horse from doing it, weaving bars. Don't approach these problems by physically preventing the horse from doing what he wants to do, because you will probably have problems, and it doesn't meet the horse's need. Here's pawing, and this is an old engraving, but it shows the usual reason that horses paw. They're frustrated. These horses are tied, and this horse in particular would like to move, and he can't. So pawing is usually done in that situation. The natural reason that horses paw is to get to food covered by snow or dirt. So it's not surprising that it often occurs around feeding time. Here's a quick stallions, like Mr. McDonald's heard, but notice that they're pawing, and pawing often accompanies aggression between males. This is the horse just waiting for the food. And the problem can be that they can even wear their hooves down. But we studied pawing in standardbreds, and it's really interesting in that standardbreds don't paw when they're expecting food. They paw after they've been exercised. And they don't paw much on Sundays when they're not exercised. So that made us feel that perhaps it was a pain problem. And I have a picture of one horse who was standing in the hole that he had dug, as if taking the pressure off of his forequarters in this case was relieving his discomfort. I haven't been able to follow up on this, and I've been trying to persuade somebody else to look at standardbreds who paw to see, this is one horse, do all of them stand in their holes? So if anyone wants a project, this is a good one. We think that a lot of pawing is paired with food. That is, the horse paws and the feed cart comes up to him. And so the next time he starts pawing earlier and earlier, because he's learned that if he paws 300 times, the food will come. As I said, sometimes the pawing is frustration, and this waiting for food is frustration. I've had a horse, a stallion, who pawed all right, but he was trying to reach the horse in the next stall. And the solution, which I do not approve of, was they made his stall floor concrete, so he couldn't paw through. And then we talked about standardbreds. So try to reduce the horse's frustration. We are such a puritanical society that we say, this horse is pawing, so I'll make him wait longer for his food. Well, if you knew the principles of learning, you would know that if you increase the number of responses that an animal has to make to get its reward, it will do that behavior more and more. So you're actually making the horse worse. You can stand in front of the stall and count to 3. If he doesn't paw, you give him a handful of oats, and then try to get him to not paw for a count of 5, and then a count of 10, etc. I've had one owner who did that. Most people are not patient enough, and I'm sure I'm one of them. In particularly in the case of the standardbreds, you might try treating lameness. And in fact, the person who wrote into me has a horse that's had a lot of injuries, and perhaps treating the horse with a painkiller would reduce the weaving behavior. Here's a horse that kicks the stall. So they can kick the stall because they're anticipating feeding, but more common is a horse is kicking the stall because he is being aggressive to the horse in the next stall. That's relatively easy to solve. You just rearrange the horses so the enemies aren't next to each other. But I have had stallions in particular presented who would kick down a oaken wall. They kick so much and so hard. This horse kicked the stall, then he injured his hock, and then he exacerbated that wound. What we did for him was we padded the walls of the stall so that he didn't have as much concussion. And sometimes we think the horses actually are making noise for environmental enrichment. They'll rattle buckets or they'll kick the stall. So sometimes putting these wall kickers on a wooden floor so they can make noise without kicking solves the problem. So it can be aggression, it can be learned, we get food if you kick long enough, frustration, or for environmental stimulation. Okay. So what about toys? Every time I go to Agway, I see all these toys, and they rarely help unless a horse is young and playful, particularly colts will be helped by toys. There is or was a chew toy for horses called the pacifier, and it was apple flavored wood. And that helps slightly reduce wood chewing because in fact it is wood chewing. There are gadgets, a food dispensing barrel. The horse turns the barrel and some food comes out. It should help because it stimulates grazing-like behavior, but I haven't had too much luck with it. And I had one horse who just picked up the barrel and threw it across the stall rather than play with it. So grazing is what horses would like to spend most of their time doing. So what about the effect of diet? We did an experiment where we fed the horses either a complete horse feed and they got 7 to 9 pounds of pellets twice a day, or we fed them hay. And so the horses were in both diets, so we could test the same horse under both conditions. And what we found was big differences in their behavior. Here's the horse fed pellets. He can finish in this case, her pellets in 10% of her time, and she spends most of the rest of the time standing, whereas the horses with free choice hay spend 50% of their time eating and only 40% of their time standing. What this blue bar means is that the horse was sifting through the bedding, presumably trying to find something to eat. We call it browsing. So whereas the horses with free choice hay didn't do that at all, the horses fed pellets kept looking for one more pellet. So same horses, different diets, big change in their time budget. Okay, so this horse has a cradle on because otherwise he will bite himself. So that's physically preventing the horse from doing what he wants to do, but it's not solving the problem. And here you have a gelding mounting a mare. And when the mare is taken away, he rushes to the fence, looks longingly after her, and then he turns around, bucks a little bit, and bites at himself. So that is self-mutilation. Here's another one. I really coveted this horse, but you have no problem. He's trying to bite his flank. And he did it all of his life, when he was a stallion and after he was gelded. And many of these horses have a physical problem, pain producing problem. And that's why I was here at Cornell to see if they could find what was wrong. They never could discover a reason for it. And he continued the behavior for most of his life. Let's see, I think that's it. So if you have a horse that's biting himself, and it's usually a stallion, I cured one by putting the stallion out with the mare, and that cured him. But the ones that have a physical problem will not be cured by that. So what about oral stereotypies? There are two, cribbing and tug movements and wood chewing, but wood chewing is different in that the horse is consuming wood, and I will show you one at the end. So don't confuse these two, because in one case you'll have little crescent marks on your fence, and with this you won't have a fence. So this is typical cribbing behavior. She makes mouth movements, and then she grasps that horizontal surface, she flexes her neck and aspirates air. So that's cribbing. Here is a pony cribbing on the fence rail. And I have another picture of another angle. So he's grasping something with his front teeth, except he has no front teeth. He's been cribbing so long, he's lost his front teeth. But he lived to ripe old age. The horse flexes his neck, and this horse was really good at flexing her neck. And so what do they crib on? It turns out it varies from horse to horse. Yellow is wood, and Mouse really liked wood, and she would eat some of the wood. One horse, Lucy, the one who really flexes her neck, she would only crib on metal, which meant all you have to do is put her in a non-metal environment, and she would not crib. Most horses are pretty flexible, like River will crib on anything. And so there is a strict preference. What is cribbing? The horse is aspirating air into his lungs, but also into his esophagus. This is what it looks like fluoroscopically. His esophagus is filled with air. He doesn't swallow, but the next time he takes a bite of food, he'll push that air into his GI tract. So he doesn't swallow it, but most horses are cribbing while they're eating, and he pushes that air down. When do they crib? Well, this is a Japanese study showing a horse cribbing along 50 times per 15 minutes, and they give him hay, and his cribbing rate drops precipitously. In the bottom half, the horse is given grain. So he's cribbing along, you give him grain, and his cribbing rate goes way up. So obviously, one solution is more roughage and less concentrate. That probably won't cure him, because once they've started, they spend a lot of time doing it. This is one horse, and this is the percentage of time. We looked at them every minute for 24 hours, percentage of time that they spent cribbing. So at 11 o'clock at night, she's spending 60% of her time cribbing, falls down during the day when there's a lot of activity to only, 10, 20% of her time. But when she's undisturbed, there's cribbing all of the time, which means, 14,000 cribbing actions per day. Who does it? Thoroughbreds do it. Dressage horses do it. Eventing horses do it. And most of these horses are thoroughbreds or thoroughbred-derived horses. We did a survey through Equus back in the day when that was a magazine. And we found that 4.5% of American horses crib. Thoroughbreds, 13%, warm blood, 7%, quarter horses, 5%. We didn't distinguish appendix quarter horses from non-thoroughbred quarter horses, because my guess is this relatively high percentage is probably due to those thoroughbred cross quarter horses. So what do we do about it? Well, the surgeons have a great time. Making a hole in the cheek doesn't do anything. Cutting a nerve in the neck, the accessory 8th cranial nerve, or cutting all the muscles in the neck, omohyoides, sternocleidomastoideus, sternothyroideus muscles, or a combined neurectomy. You cut the nerve and you cut the muscles. Let me show you what happens when you do that. So this was a horse that was donated to us for a cribbing study, and you could not pass a stomach tube. And the reason you couldn't pass a stomach tube was that she had a scar on her neck from that surgery, and that scar impinged on the esophagus, so you couldn't pass a stomach tube. So for a horse that cribs, it's going to colic, that's a very bad situation. You just see a little closer, you can see the dent in her neck from the surgery. The latest surgery is more drastic than what that horse had. You cut the muscles from this point under jaw practically to the chest, and you're cutting all of these muscles. Does it work? Yes, if the horse just started cribbing, but almost anything will work when the horse has not been cribbing very long. And the cosmetic and complications following the surgery are pretty bad. So I don't recommend it. So what can we do? Well, we can use cribbing straps. They're plain and nutcracker and miracle collar. I'll show you all of these, and a cribbing muzzle. So you can have, of course, I covered up the nutcracker with fleece, so that doesn't show you much, but just something around the neck that prevents the horse from flexing his neck. So I'll show you the miracle collar and the cribbing muzzle. So here they are. This is just a leather strap with metal here that you put around his neck. Here's a nutcracker. You can see why it's called that. Again, it keeps the horse from flexing his neck, as this does. This is a miracle collar, and this sharp piece of leather sticks into their throat latch. And here's the muzzle. Horses hate that. So here's a horse with a muzzle on. Actually, it's also wearing a shock collar. It was on the market, no longer is. And when the horse would flex his neck, he'd get a shock. Well, it was worth my life to take that off of a horse who was flailing around because he hurts, so he flexes his neck, so he gets shocked again, and so on. So not a good idea, as well as being cruel. So the muzzle, he can't touch the horizontal surface, so it's very frustrating for the horses. It comes with these nice little leather straps. The next morning, those leather straps will be broken. Because the horse really wants to reach the horizontal surface and will do a lot of damage to the stall and you, if you're in the stall with him. And this is the quiver in place, the shock collar. Here's a miracle collar on a horse, and the miracle is that the horse cannot get it off, because it has a strap behind his ears and in front of his ears, so it's pretty secure. To really work, it has to be pretty tight, and you will get scarring in the throat latch, but it is effective. You can use a drug, naloxone, that stops cribbing, but has only been used short term by the people at Tufts, and would have to be injected by the owner, and it probably has bad side effects on the GI tract. No drug company is willing to put in the money to test these drugs for a problem that only affects 5% of horses. You can modify the environment, increase the roughage, both the amount and the variety, hay and haylage, hay and some sort of browse, put the horse in a compatible social group. You can give him a cribbing bar so he can crib with impunity and not ruin your stall fixtures, but there are reasons not to do it. Why? Why treat it? Well, you get tooth wear, you get hypertrophy of the neck muscles, and in some cases, you'll even get weight loss, a horse that rather crib than eat. Much more important is that you get gas colic. I'll show you a picture of epiploic foramen entrapment. So this is a very serious consequence. You can also get osteoarthropathy of the temporal hyoid joint because the horse is doing that thousands of times a day. That is exercising that joint. Some owners will say if the horse can't crib, he is depressed, and gut motility apparently slows. But we found that our horses, at least, were not stressed by having all of these gadgets put on them, partly, I think, because they've been cribbing for years and they must have had cribbing collars before. But it doesn't seem to be a welfare issue. When you stop this? Oh. Then there were the cribbing rings. These are just copper rings put between the horse's teeth. Yes, the horse will stop cribbing, but only for a little while. Also, it's very invasive and probably painful. The horse puts these on a horizontal surface and it hurts him. So I don't recommend those. Here's the reason why cribbing is such a medical problem. If the horse is not cribbing, this is his intra-abdominal pressure, and it stays low. If he starts to crib, then the pressure in his abdomen increases. And that allows loops of intestine to sort of float around and get caught in various places, but particularly the epiploic foramen. I had to look it up when I first saw the term, but it's this space, and a loop of small intestine became entrapped in there, and it should not be dark red. It should be nice pink color. And this was one of my cribbing horses, one of my favorite horses, who died of this while being in a cribbing study. So if you have a horse that cribs and you have had to call the vet more than once for a gas colic, I would use a cribbing collar. So people get upset because the horses damage things. They will pull buckets off the wall. They will pull fence rails down. So we want to know just how forceful the horses were. So we put the horse in this stall. The stall door is not locked, isn't latched. So if she cribs, she pulls the door toward her. And when she does that, she pulls on this pulley and lifts these weights. And so we would keep adding weights until she could no longer open the door. And we discovered that here she is cribbing, and here she is cribbing with the bucket on the pulley. So how much force do you think that cribbing horses exert? Well, we found there was 25 kilograms or 50 pounds, depending on which system you use, every time they crib. They are lifting essentially 25 pounds. So it's not surprising they do so much damage to the fences. Is cribbing learned? Poor cribbers are often put at the end of the line of stalls, or they can't even be boarded someplace because there is this old, I don't want to say wives, old horse trainers fable that horses learn to crib from other horses. And there is no evidence of that. When we surveyed horse owners in our cribbing study, we asked how many of you have had cribbers and non-cribbers at the same time, and how many horses started to crib after the cribber joined your barn. And of 118 cribbers who lived with other horses, only 12 other horses began to crib. So that's less than 10%. So I don't think it's a big risk. It turns out one risk is if the horse is next to an aggressive horse, is more likely to crib, not next to another cribber. Is it inherited? Well, some of my friends have looked for the gene for cribbing without success, both at University of California and University of Florida, but I'm sure it's out there. And that because if we find the gene, we can try to breed it out. Although my hypothesis is that it is linked to speed, and that's why it's been selected for in thoroughbreds. But I could be wrong. But speaking of thoroughbreds, this is a fairly famous thoroughbred, and it sure looks like he's cribbing to me. You can see the marks in the fence. When does cribbing start? It starts at weaning. If you do interval weaning, where you leave the foals in pasture, but you remove the mothers in order of the age of the foal. So you start with 6 mares and 6 foals, and then you have 4 mares and 6 foals, and finally you have only foals. That is non-stressful because the horses are with their social group and they are eating grass. If you take a foal and start to feed it grain, that's when it's going to begin to crib. So the stress of weaning has to be paired with this diet change, and having 2 foals together in the same stall will not help. What about opiates? Well, they've been measured and in cribbers and non-cribbers, and some find they're higher, some find they're lower, and some find they're the same. And there's no one in the US now who measures endorphins in horses. So opiates may fall when horses crib. And we know that opiate blocker inhibits cribbing immediately. If the horse cribbed and got a high from it, and you stopped the high, you would expect him to try and try and try to crib and crib, but he stops immediately. And that to me means that opiates may stimulate cribbing. So I think that the horses taste something sweet and opiates are released. Now, this happens in rats and in babies. In the old days, when a baby cried, you'd give him a sugar teat, had lousy teeth, but he stopped crying. And that's because opiates are released. And that stimulates cribbing, I think. However, the breaking news is that a horse has been cured of cribbing using pot. So cannabinol does stop cribbing in one Italian horse. And so I would be very happy to treat cribbing horses with this drug, because it would certainly be less cruel than all the cribbing collars. So what about wood chewing? Well, in the case of wood chewing, the wood is actually ingested, so it's very destructive in comparison to cribbing, which may pull buckets off the wall or fence rails down, but doesn't destroy things. It's also seasonal. It tends to occur in late winter. Let's see if we can get this to work. So here is late winter in Ithaca. And this is, of course, doing what horses in the wild do. They're eating new growth from trees. This is just showing you what wood chewing can do to your fences. And this shows you a horse that really likes wood. She began with chewing on fences, but now she's progressed to eating wood chips, and she will even open the package to get to the shavings. So in the old days, we used to put creosote on wood to keep horses from eating it, which is very hard on your clothes, but creosote has been outlawed. And so now you'll notice that a great deal of equine research park has metal on top of any wooden surface. And let's see. So what causes wood chewing? A lack of roughage and an appetite for browse. And there's one study that shows that exercise can inhibit wood chewing. So wood chewing happens in the winter, and not many of us have the willpower to ride our horses very much in the wintertime. So that's not too surprising that you see the wood chewing then, although I think it may be an evolutionary result. Those horses who are willing to eat this wood got enough calories to get them through till the grass began to grow again. So more roughage, I said 2 types of roughage is better than one. Straw bedding, you can do repellents, they're commercial ones, detergent, you could just put Joy on your fences, which will work until the next rain. Metal coverings, and I talked about creosote. Just so you can see how much damage a wood chewer does. Under the cobwebs, there is chewed wood. So this is a non-serious abnormal behavior. This pretty little Arab stallion would stick out his tongue, but only if in front of his stall was a blonde young girl. My guess is that some blonde young girl rewarded this horse for sticking out his tongue some years ago, and the horse would still do it. Not a serious problem. Here is a horse doing tongue play and shaking his head. Again, the food is on his way. So a frustrating situation. So here's a stall, which in some ways is very nice. I mean, that's certainly enough bedding, enough straw bedding, and there's plenty of hay, although it's only one type. And hay nets are a great way to make it harder for the horse to gobble his hay. Unfortunately, if you put it up this high, you may get particles into his respiratory tract, and that's not good. If you put it down low, he's going to stick his hoof in it and injure himself. So very difficult to do. What's wrong with the stall? No windows. This is Newmarket, the British Stallion Center. So plenty of bedding, but no windows. So here's a happy horse grazing. Oh yes. And Dr. Goodall wanted me to talk about quitting. And so I waited long enough that my pony, who is, in his 20s, quitted. This is just semi-chewed food that the horse spits out. And he's not doing it just to annoy you. He's doing it because he needs his teeth floated. So if you see these things, call your vet. It's time for some floating of his teeth. I think that is it. So I'd be happy to answer any questions, and there seem to be a lot. And this is my horse trail riding.
Thank you very much, Dr. Houpt. That was great. And you're right, we do have a lot of questions. So I'll get started asking them of you. There were a few good related questions in the vein of, can you comment a little on when horses seem to weave when they're in an open area, maybe along a fence line?
Well, generally, I think it's escape behavior, so they would rather be outside that fence. And once these things have started, I think it's actually pleasurable for the horse. You know, a lot of children will do weaving behavior, especially those that are brain injured. And so I think that may be what keeps this behavior going, even when the owners put them in a good social situation.
And then a related question asked if this could be because maybe they're fed when they come inside, and so maybe
Well,
anticipatory.
sure. And if, for example, I was studying Przewalski horses in the London Zoo, and they were only turned out every other day. And so, you know, they were very, quote, happy to be out there running around and playing, but they were let in at 4 o'clock in the afternoon, and 3:45, they would start hitting the metal door into their enclosure because they expected to go in and be fed. So I think once a behavior has started, and especially if the horse is anticipating food when he gets out of that particular pasture, that may be why he does it.
And then related, you mentioned children. Someone had a question kind of along those lines. And they're wondering, sorry, I've lost the question. If, perhaps, do you know if there's any relation between stereotypies and kind of stimulation that people who are neurodivergent sometimes perform?
Well, I think, yes, I think it is probably pleasurable to do that activity. And even the horses that are circling in their stall, there may be something comforting about that.
And would you consider it coping in some cases?
Yes, you can do that. I don't let a coping strategy mean that you don't have to do anything to make the horse's life better. But yes, I'm sure that probably is the reason many of these persist, because it does help the horse deal with whatever is stressing him.
Thank you. And then there's a couple questions about if a horse lives alone or doesn't have any kind of contact or visual contact with other horses. I think the question is just, is that an issue?
Well, probably the horse will try to escape a lot more often. And they usually do much better when they're with other horses. And this is Michigan. I was living in Michigan with my horse and pony, and someone came, I lived in the middle of nowhere, and someone came up while I was reading a mystery and almost jumped out of my skin. He scared me so. But he said, how many horses do you have? And I said, 2. And he said, well, there are 3 horses now. So I went to my pasture, and yes, my neighbors had gotten another horse, a lone horse. That horse had broken out and joined my horses. So yes, I think they prefer to be with other horses.
Right. Yes. So yeah, in general, you should have more than one horse housed together, at least visual contact, right?
Yes.
It's not a question per se, but using a mirror to potentially treat weaving behavior, do you find any success with that?
Stall walking and weaving, people have tried, especially in the UK, they have used mirrors and even a poster of another horse. And horses certainly recognize a horse because they will attack the mirror sometimes, especially a stallion is likely to do that. So you can try that. Clinically, I have not had success, although I have recommended it to people. But you know, it's a bit of a economic investment, but it might be worth it if it would stop the horse from doing that. Might be easier to get a mini to keep him company.
I don't think anyone's ever said it would be easy to have a mini. And then another interesting question, you mentioned the standardbred who is pawing to create
Yes.
potentially a hole to stand in. Someone's asking, can that be related to ulcer pain if it's after exercise?
What kind of pain?
Ulcer, stomach ulcer, I'm
Oh,
assuming.
well, that's a good question. Yeah, that's a good question. So the next pawing standardbred, we'll treat him with an antacid and see what happens. I have a painting, my screensaver is a painting of a British painter, and one of the horses is being saddled. I sent it to Dr. Goodall. The horse is being saddled and his ears are back and he's kicking. And she said, yes, they should give that horse antacids because it's probably a response to a sore stomach, to ulcers. And 90% of performance horses have ulcers, which gives you an idea of we don't treat them very well. So,
well, and it's been around for a long time, as evidenced.
yes, it's been around for a long time. Yeah. It's not just us.
And this was an interesting question. The person's asking, is the benefit of free choice hay diminished if the horse is also fed grain?
Well, yes, probably, but the horse, especially if it's a pony, you'd get along fine on nothing but hay. But if you're working the horse, he probably needs the extra calories. So.
Right. So case by case, good
Yeah.
idea to ask your vet though, for sure.
Yeah.
And then you briefly mentioned something along these lines, but this person has a question specifically about preventing cribbing. Would a spicy spray, would you recommend anything like that?
Now, I hope that at the end of this hour, you have realized that that was not the approach that one would take, because it's just like hitting the horse because her leg hurts. The other thing is there are no taste or pain receptors in the teeth. So it's probably not going to make any difference anyway. So save your money and instead give your horse more hay.
Or spend your money on that instead.
Yeah, spend your money on that instead. I don't mean to be flippant, but punishing the horse is not a good idea.
Perfect. And this is an interesting question. So they're wondering if you've ever seen something that the person is calling coping grazing as a calming behavior. So if the horse is stressed, they seem to more urgently seek out grass and kind of chew very rapidly.
Well, I've certainly had people use that. Their horse is jittery at a horse show, so they take him over to graze and he calms down. So I didn't know that there were horses that were smart enough to self-medicate, but that sounds good to me.
Yeah. It also makes me wonder a little bit about ulcers sometimes if a horse urgently seeks out forage, but
yes,
hard to say.
Well,
right? Yeah.
Probably I'm hoping that most of our pet backyard horses do not have ulcers, but as I said, most performance horses do. So
yeah.
I did have my horse scoped. And it was the most embarrassing moment of my life. They found a bot.
Oh.
No ulcers, but a bot. Oh, dear.
So sorry to hear that. And then, so sorry, I just realized we're past time. So I'll ask one last question that I think summarizes your talk quite well. They're saying, have you found that allowing a horse to live a more natural lifestyle can solve many of these issues?
Yes.
And with that, we bid you good night.
Oh,
yes, I thought that was a perfect question to end on. And there are a few remaining questions. I'm so sorry we couldn't get to all of them. If you did have a question you were really hoping we'd get to and we just didn't have time, please do feel free to reach out. There's an email, I believe, Vanessa, on the website. And you can reach out to us if you really wanted your question answered, and we can forward those to Dr. Houpt or get you the appropriate resource.
And so I make farm calls.
Dr. Houpt makes farm calls in upstate New York. And occasionally to the city, the theater, if I recall. So yes, we're very happy for you to contact us. Vanessa just put that email. I think you only sent it to me, Vanessa, but she'll post that shortly in the
Putting it in the
chat.
chat.
And thank you so much, Dr. Houpt, very
You're
much.
welcome.
It's
So
great
it's
hearing
fun.
from you.
Thanks, Dr. Houpt.